it's Mental Health Month, and we should take care of our health so that we at least self-advocate so that that self-actualization comes through. Of course, I'm Hemophilia. Today, I'm with
My name is Umbati Yano. I'm a medical professional and I'm happy to talk about mental health.
Leisha. Joining by my left far end, I'm with Perfect. So, let me get something so that we all understand that. We all understand that from a retrospective way going to forward, where diagnosis and where understanding comes to terms with technology, comes to terms with peer counseling, and comes to terms with understanding that a blood disorder can't just be there, but it's manageable. So, Enoch, tell us something that will even ignite hope for others living with a blood disorder like sickle cell, living with a blood disorder like hemophilia, not forgetting #women bleed too, the von Willebrand disease. What can you tell us about, on a retrospective way, about Kenya Hemophilia Association and now as that care within people living with a blood disorder?
Okay, so I think first I would say health is the first wealth, and I think a lot is happening in the country in terms of creating awareness to do with blood-related disorders. The most notable ones are hemophilia, sickle cell, and von Willebrand disease. But this is just a tip of the iceberg. But there are more conditions which are yet to be managed or discovered. Kenya Hemophilia Association is doing a lot of good work in terms of creating awareness, ensuring those suffering from these diseases have access to the necessary treatment and the support services they need. And also this is in conjunction with other partners, including Wellbeing Kenya and other organizations which champion for the rights of those suffering from blood-related disorders. So what I would say is most people actually don't tend to realize much later that they're having these blood-related disorders. So hence we are trying to push for early screening and early detection. So through early screening and early detections, management can be started way earlier, and this in turn improves the life quality of the patient or the individual.
Great. You said Red Movement Kenya. How have you interacted, or when did you interact with the Kenya Hemophilia Association as that person from Red Movement?
So I think this was during my college days. So Red Movement was started as an initiative to sort of help Kenya Hemophilia Association in realizing its objectives and goals. As students who are taking part in these hematology classes, and some of our friends and classmates were having this kind of diseases, so it was really important to help them and also understand exactly what this condition means. It's not a life sentence when you have these blood-related disorders. There is help, there is treatment, and you can actually lead a normal life like the rest of the people. And at the same time, it's good to see when these hemophilia patients and sickle cell people, I know they might have challenging times, especially during crisis or when they might not engage in other forms of physical activity as the rest, but we are trying to find ways in which they can express themselves, and also in ways in which they don't end up affecting their health status.
Perfect. Let's integrate mental health with how Red Movement has really impacted how mental health works. So, hearing from Priscilla, what can you say that the life of students in Mount Kenya University can integrate Red Movement, can even integrate that mental health perspective in the space of campus life?
My opinion is, in terms of Red Movement, what I understand is it's an organization that is majoring on diseases, or rather illnesses that maybe go hand in hand with the blood. diseases, they come with maybe drastic pain, or rather the fact that you're always in a trauma mode or in an anxiety that you will die at the end of the day. So in terms of mental health I would rather encourage students to, even if you're not hemophilics or having any kind of blood-related illnesses, that you need to support them. You need to know how they are doing in terms of their mental health, because most of them, what I know, that they've lost hope and they're just waiting for that time, and maybe they won't live their life as it is at that point, because at the end of the day, you know where your fate is. So that's my thing.
She does. You've learned you're not alone, and we can manage it through self-awareness. What do you advocate in Mount Kenya University so that students even can come to you, and you can even spread some knowledge so that they understand that peer counseling, when it comes to now mental health, we all need to understand that we can reach out whenever we feel something.
Okay, I know it is coming from we are third world country. In terms of Africanism, you know that most people don't believe in talking about it. But we used to be told when we were young, a problem worked, a problem half solved. At the end of the day, maybe you would find what maybe a solution to it, but you already have solved it by actually debunking whatever you feel. So I would love people to come talk about whatever they're going through, and most of the time our solutions are within us, and always tell people that your mind and yourself is your biggest enemy, because what you tell your friends is not what you tell yourself most of the time. Most of the times you want to tell yourself things are not going on the right path, but when a friend comes to you with a problem, you always tell them that I think you're the one overthinking, but that is not the same advice that we give to ourselves. So we be self-conscious, we do self-care to ourselves, and we be gracious to ourselves at the end of the day, because we are all trying and we're doing life for fast. So yeah.
Take care of yourself. This comes from an empowering person. So take care of yourself, and you'll unlock that self-infinite possibility. I must say that I appreciate. And what can you tell the students in Mount Kenya University about your your campus life, your college life? That since you went through that process, what can you shed a light on mental health and other related, like anxiety, like depression? What can you say?
Okay, so I think actually moved by what Priscilla said. I think problem shared, problem half solved. And again, I want to emphasize on it's no longer you and versus you, it's you and you. So once you have that mental shift from attacking yourself by either sort of self-criticizing and doing all this damaging stuff, so it's rather move from you versus you to you and you. So find those friends, find those comrades, find those support groups, and actually join into them. I think college it's a very crucial stage in somebody's life, because it sort of opens you to the world. You meet a number of people, you meet people from different backgrounds, different perspectives, and I think for any college student at the moment, it's important to keep an open mind. It's always important to be open to learning, because every day is a learning opportunity. At the same time, focus on your academics, focus on the things that really push you forward, and I'm sure come graduation and come forward, you'll reap the fruits of your labor.
Gracias. What can you tell us about the question I asked?
About my high school life regarding mental health. Avoid peer pressure.
All right.
Avoid peer pressure when it comes to the university life. Be you, do you in whatever way, and trust in whatever you always trust in. make sure you channel your endeavors to one thing, because at the end of the day, I know it is your 20s. I know hectic how 20s are. You're trying to find stability. You're thinking like, is this the course that I really wanted to do? Is this the life that I really wanted to stay? Tuliambiwa tukiwa high school tukitoka tukimaliza shule tunalala kweli. And at the end of the day, just be and keep on emphasizing, be your own cheerleader. The moment you wait on people to cheer on you, you'll wait forever. And do what you think is right for you. We are all learning at the end of the day. Make those mistakes and then have that tendency of coming back at the end of the day. So yeah, that's my take on credit recognition.
All right. Be your own cheerleader. Learn from, I must say, just, I love how they're responding. So, what can you say about the life of students that you see in campus that need to be changed and that you can advocate? And as a last message, what can you say about that?
So I think the world is constantly shifting. The employer is changing, because at the end of the day, after graduation, you need to look for work. So I think it's important to start creating those early changes in your life, so that you start being professional, you start being accountable, you start taking these chances. And we're moving into a more tech-driven world. The advance of artificial intelligence and all these things which are surrounding us, we do believe they're going to change on how we live, on how we interact, on how we do our work in the future. So as you are studying, it's important to understand the kind of environment you are in, where the world is moving to, and also to curate your efforts and your studies towards that, so that you don't get left out or stay behind. And I think again, as a Gen Z, or with the current political environment and the current situation we are living in, I think it's important that we stay focused. It's important that we do we do things that are that bring hope and prosperity back to us.
Great.
My parting shot is actually just concurring with what Lydia said. Be positive at the end of the day. There's a lot of negativity outside. You're reading and you're not finding jobs. Just create something now and be positive about your life. My life is not your life. Another person's life is not our lives. And we always tend to get advices from a lot of people around. So, and then hence making us become confused. And keep on emphasizing, be positive, be your own cheerleader, and create your own opportunities. With that, you can be anything. Yeah, thank you.
Today, you've been challenged, and I'm partnering with the Red Bull. So, you'll tell us more about Red Bull and what having wings entails.
So I think, I really like the Red Bull slogan. I think the wings thing, it's really amazing. And so I think I'm actually pleased that Pius is actually this creative, and this is one of his creative outlets. And I'm also happy having been invited on this interview. This really shows how much Pius is moving out of the way into being a content creator, into channeling, and also creating this awareness. So congratulations and kudos to you. This is amazing. So Red Bull is doing this promotion whereby they want people to do this creative outlet, and then in whichever the one which wins, they get invited into a riding competition. It's a really good way to actually exercise. It's a good way to actually be out there with the people and also learn what other stakeholders are doing and what you can actually go to and learn from the
Great. So what we learned today, try and at least understand that we can do it and you're not alone. So thank you for reaching out. Thank you. Stay shujaa.